You forgot?
This one, maybe.
Let me see. I don't even have on my headphones.
Just between you and me, this is love. There's no tricks. Ooh, this is love. Just between you and me, this is nothing. Ooh, there's no tricks. This love is. Just what do I have to do to let you know? Should I make your flowers grow? Should I make it rain or snow? Yeah. So many things I've done just for you. Forest green and ocean blue, just to show my love is true. Just between you and me, this is not. There's no tricks. This love is so real. Just between. This is not. There's no tricks. This love is so real, yeah.
Don't you know I taught the birds to fly on the stars up in the sky? Can you guess the reason why? Can you take more than a passing glance? Nothing is by happenstance, yet you think it's just by chance. Just between you and me, this is not no tricks. This love is so real. Between you and me, this is not. There's no tricks. This love is so real. Ocean deep, river wide, valley low and mountain high. All create night. There's no tricks. Yeah. This love is so real. Between you and me, it's not. There's no trick. This love is so real.
Just between you and me, this is not. Oh, this love is so real. Oh, this love is.
Ocean deep, river wide, valley low and mountain high. All creation
is so real.
All my love is so real.
I don't know what just happened. Our joint just unexpectedly
What up,
quit. So if you were on the live a second ago,
Oh shoot, what's that?
that's the thing that's gone now. You weren't even looking at the screen when it came up. So we are here.
We be messing
We
up,
are live.
y'all.
No, it wasn't our fault. You know what I'm saying? The ACAM just all of a sudden unexpectedly quit. I've never seen that happen before. But I'm starting to think we might need a new computer.
Hi guys. Look, he trying
What's
to
up,
get a
y'all?
new computer. Hi guys.
There were comments to share on the screen from the first time we were live.
Yeah, we don't know where we don't
but
know where
those
the
people are
comments
gone
went,
now.
so.
You know what I'm saying? Because it's a whole new live. And we are glad that you are here tonight. Welcome to Ask John and April Live. We're excited to have you tonight. We're excited to be here tonight. It has been, I don't know, 2 weeks? Did we go live last week or 2 weeks? I mean, we didn't go live last week.
No, we
Was
did
it 2
not
weeks
go
ago?
live. I don't even remember the last time, baby.
I can't remember the last time.
cannot
we were
remember the
live.
last time.
Whatever it is, it's been a little while.
Yes.
Hey, Wanda. How you doing?
Hey,
Glad you are here
Wanda.
tonight.
Hey, Brittany.
Brittany, glad you are here as well.
Yes.
If you got kicked off, sorry about that. It's because,
Yeah.
you know, our
I
stuff
know
is
Lovely
jacked
Rose
up.
was on and Madeline.
That's true.
Hey, y'all.
Anna says,
Hey,
I let the
Anna.
girls tune in with me to see you before the convo starts, but considering the topic, I think I'll pop my earbuds in right about now.
Hi, girls.
You have more time than that to pop the earbuds in. What's up, girls? Good to see you.
Yes. We miss you guys.
We do miss you guys. And you can keep listening until we bring the guest on. Once the guest comes on, you have to go to bed. I'm so sorry, ladies.
Yes.
You guys aren't old enough.
Right.
Madeline says it's been 2 weeks.
Okay. Wow.
Yeah,
It's been
yeah.
2 weeks. Okay.
So if you don't know, I've been on sabbatical. I was on sabbatical for 3 months, and now I'm back to work. And I feel great. And work has been amazing. The people have been extremely, I don't know if excited is the word. It's just people have been very welcoming to my being back in the pulpit, at the church, all that stuff.
Right.
And as you can see, I'm full of energy.
Yes,
So
he
the
is.
sabbatical actually worked. Crystal,
Crystal?
what's up? How you doing? Glad you're here tonight. And Anima says noted. Yeah.
Yeah.
So tonight's subject is definitely one of those subjects that if you have children, if they're still awake, you probably want them to go to sleep. We're going to
Or
be
just
talking
pop
about.
in your headphones.
Yeah, that's true. You can do that. Yeah, that's right.
You know, pop your headphones on.
Richard Bryant, what's up? How you doing? Primo, time to retire. You mean like go to bed, retire?
Or you talking
know what
about
I'm saying?
John retiring?
Yeah, retiring from what though? Like, because I'm not retiring from ministry yet. It's too early. I'm only, 50. Just kidding. I'm still in my 40s.
Wow, why do you do that? You know what? Okay, no, really, I just don't understand John.
Because I think people would think I would look young for my age if I told
He
them I'm 50.
always talks about him being older. And I'm like, why do you do that? You're already at an age. You're already 43.
Am I 43?
Like, why would you say 50? That's 7 years from now. Like,
That's true.
I mean, if you were 48, okay. But, I mean, why do you do that?
I don't know. It's fun. April hates it when I make her old. That's what she really doesn't like. You know what I'm saying?
Listen.
Wanda says she already got her headphones on, so she's ready.
All right, Wanda.
She's ready to go. So what my point was, you probably want to share this tonight. Go ahead and share because we're talking about sexual health. It's one of those conversations. We actually have a very special guest on tonight.
Yes,
We're going to introduce
I'm
her
so
in a second. She is a medical doctor, so she's going to give us some scientific and medical advice. We probably should have a disclaimer and say that.
Listen, she's going to tell it like it is.
She is.
all right?
That's true. But
She's
she's
not
not.
holding
She's not your
nothing back.
doctor, so it's not like if you take the advice that you can sue us. So whatever the thing is that you're supposed to say there, you know what I'm saying.
Right. Whatever.
But
it
anyway,
is, yeah.
Glad you guys are here tonight, and so why don't we go ahead and tell them about our sponsor for tonight.
Yes, guys. So we are sponsored by our 30-day intimacy challenge for
Yes.
any married couple at any stage of your relationship. And tonight we are giving a 50% off coupon code at the end of the show.
So stick around to the end.
So stick
you can get
around
that.
so that
Yes.
you can get 50% off of when the beat drops. I can't talk anymore. Hey, you gotta finish that.
You should be able to continue telling. But anyway, 50% off.
Yeah.
The coupon code will be at the end of the show. You'll be able to see it. Our 30-day intimacy challenge. We've had people go through our 30-day intimacy boot camp and our 30-day intimacy challenge, and they have told us that it has helped them at whatever stage of intimacy they are in their relationship. It's helped them to deepen and go to the next level in their intimacy,
Yeah,
in
so
their
where do
relationship.
they go?
All you have to go to is go to our website, justjohnandapril.com, and you can see how to sign up and stuff. But you want to wait till the end to sign up, because when you do, in the checkout section, you can put in this coupon code we're going to give you at the end of the show.
Yes, but you can go to justjohnandapril.com and look at the
Free intimacy
reviews.
assessment?
Well, you can't take the free intimacy assessment.
That's
but
true, too.
Intimacy assessment. But I'm talking about the what am I trying to say?
The testimonials
The
of people who
testimonials
have
of people
taken
who've
our
been
stuff.
through
Yes,
it and
yes.
what they have experienced. So I'm just going to put that in the chat.
Yes.
And hopefully you can join us.
All right, guys. So we're excited because of our guest that we have tonight. She is actually one of our very good friends, and we've known her for a long time. April's known her longer than I have. I think I've
Yes.
known Brandi I think I met Brandi at Oakwood, so I probably met her in 1998 or something like that. What year is she?
Really?
Because she's a year after
Yeah,
you, right?
right.
Yeah. So, I mean, I didn't know her good like that. I really met her really good when I joined South Atlantic Conference in 2000.
Mm-hmm.
So I've at least known her for 22 years. But you've known her longer than that.
I say Brandi's like family.
Yeah.
Okay, so, because I've known Brandi and her husband for many years.
That's true.
So this is family, y'all, but Brandi is, she is a wonderful person, and
That's
you're
true.
going to fall in love with her as we have. And we are delighted to have our family member here, Dr. Brandi Patrickson, who is a board-certified internal medicine doctor, guys.
Mm-hmm.
She is a hospitalist. Is that how you say it?
Yes, it is.
For Piedmont Medical Care Corporation in Atlanta, Georgia. Dr. Patrickson is she's basically our family doctor.
Yes.
I mean, she really is.
We actually don't have one here in Maryland.
We don't have one. I call Brandi. And she knows that. So my doctor's in Atlanta.
Exactly.
And we appreciate her expertise because she's always on point every single time. And she really knows her stuff. So welcome, Dr. Brandi. We are so happy to have you with
Brandi.
us.
Hi
Hello.
guys. Hey boos. That's how
How you
every
doing?
time I see them, I'm like, hey my boos. Yes, I'm good.
So one of the reasons why we have you on the show tonight, Brandi, is not just because you're a doctor, but also because you tell it like it is.
Mm-hmm.
And the last time we were with you, we were in Atlanta. This is about 3 weeks ago?
No,
Maybe 2 weeks.
more
Maybe
than
2 weeks
that.
ago.
Yeah. Maybe.
Yeah, it was
a
like
couple
2 weeks ago.
Yeah.
And
Don't tell all the business, babe. Don't tell all the business.
well, I'm not gonna tell all of it. I'm just saying. First of all, we got people on the show who live in Atlanta. This is Wanda, and Wanda says she needs a family doctor still. So, but we had a couple of discussions while we were there with you, because April and I get a lot of questions, especially during our boot camps and stuff like that, that people have about sexual health. And maybe they don't know it's a sexual health question, but they're asking a question about something that usually is getting in the way of their physical intimacy. And oftentimes they'll ask a question and we'll say, you probably need to see a doctor about that. And we asked you some of the questions and you had some very interesting things to say.
Yes.
We said, we need to have you on the show.
Exactly.
So we're excited about that.
Yes, we
Thank
are.
you,
So, I don't know if you want to get right into it or
I
what.
don't. I want to ask. I want people to get to know Brandi.
Yes,
a
and
little
go ahead
bit.
and share.
Okay.
Go ahead and share. And
Okay, well, of course, yes. I think John is right. It's probably been 22 years since I've known John. I feel like I've known April since I was like 5.
it's been about that long.
I think we went to school together when we were in elementary. That's how long ago. I actually think her dad hired my dad. So that's how long.
Oh
Right.
wow!
Right.
Wow.
Yeah, it's been that long. But yeah, so you guys, I'm board certified internal medicine. I do work as a hospitalist. So it just means I work for Piedmont Healthcare and that I'm in their hospital. So I work with the South Hospitals, Fayetteville, Henry, Noonan. So I don't have a private practice. I do work for a secondary group that is a private, and they do come into your home. It's called Resurgia. So you won't really see me as your primary care unless you're in the hospital. You have to get admitted, and you really don't want to get admitted to the hospital.
Exactly.
But if you ever do, and you're at Piedmont, I will be the doctor taking care of you. So,
Okay.
Okay.
You are
I've been
married
there
and
about
you have
12 years.
children. You've been there
Yes,
12 years.
That's right. She has been working for 12 years. That's right. In the medical
yes,
field.
I've been there about 12 years. I am married to my amazing husband, Jason. We've been together 15 years, so we have a lot of knowledge on sexual health, y'all.
Okay.
Tonight, okay, we're gonna talk about everything you should and shouldn't do. And
So
listen,
you've had children because you have two boys, so that means you've actually had
I
sex
do.
before.
I have two boys.
You had at least twice.
They're about to be 10 and 12, so we have had sex at least 2 times.
That's important. We need our doctors to really know, the behind the scenes stuff. You know what I'm
Exactly.
saying? It's very important.
Yeah.
Okay, so we get all these questions all the time from people about different stuff. And I want to start with something that I think men will care about that they would want me to ask you, but they themselves might not have the courage to ask themselves. And it's about low T. So years ago, I found out about this. I've got a buddy who's a urologist, and he told me about this phenomenon that sometimes men who work long hours or who are really stressed or whatever, sometimes will get low T and it will affect their performance or whatever. Tell us more about that. And is that something that a man should be concerned about, or you know what I'm saying?
Yeah. Let me say this: low T just means low testosterone, and it does happen to men, and it's not something to be concerned about. But I want everyone to know that every man will lose their testosterone year by year, especially after about 27, 28 years old.
Wow.
And so you lose about 1.6% per year. And initially, it's very small, so you will not feel the effects of losing 1.6% a year. But generally, when men get to 50s and 60s, they can start feeling it. They can feel more tired. The libido goes down, which just means your sexual arousal. Sometimes they have even problems with ejaculation. So by the time you're about 60, you're kind of at 20, 30% down, and then you're over 50% down by the time you get 70s and 80s. And so if you are feeling symptoms, if you're feeling like my sex drive is low, I don't have the energy I used to have, then of course I tell, go to the urologist, get your testosterone check. And they will determine, we measure it in nanomoles, which doesn't mean a lot to the people listening. But once you get to a certain level, then they may recommend hormone replacement. So
Okay.
it is possible. Now, listen, if you get your testosterone levels checked, and so you could be fatigued from a lot of different things, so stress, anxiety, depression. And so if your testosterone levels come back normal, no, you do not need to be replaced, but you may need to check other things. You may need to check thyroid functions, okay? You may need to talk to a psychologist or you may have other issues going on. So first things first, if you're feeling that, definitely get the levels checked. And then you kind of go from there with your urologist.
Now, I heard that you don't necessarily have to get hormone replacement in that situation. There may be like pills and stuff you could take, like what are those things called? Supplements and stuff like that. I don't know if that's,
Yeah, I listen, as a physician, let me say this. Because people love an herb, they tell me like, what about this herb and what about this herb? And can I take these nuts and berries and can I eat this? Yeah, you can, but scientifically speaking, we give medications based on studies. So you'll have a 10-year study, a 5-year study. There really aren't a lot of studies on a lot of herbal medications. And so that's where you would talk to urologists. There's saw palmetto that people think it's good, but I would run that by and kind of give you like the percentage of how well this works. So most of the time it is going to be a medication that's approved by the FDA. Yes, you can try other things, but how well it's going to work for you, we can't really gauge that because there just aren't a lot of studies. And all herbs have side effects, just like every medication. People think like, okay, if this saw palmetto, let me take 5 of these pills because let me give you no. You can overdose on your herbal medications
Whoa.
too. Yeah, that's
You gotta be careful.
Speaking about, testosterone and all that kind of stuff, we know women go through menopause. and have those types of issues. We had a couple that talked about, the wife going through menopause and it caused so many issues in the bedroom. She just didn't feel the same when it came to her sex drive. And I'll say this all the time, and I joke about it, but it's probably true based on what we have heard, but do men actually have a time where they go through menopause or something
I've
like
heard of something
it?
called menopause.
Menopause?
Yeah, right. Yeah.
Yeah.
Actually, and it's just really what we were saying. It is
Okay.
what they call the low testosterone. So that is the menopause. It's when you get to a point where you're kind of feeling the effects of the low testosterone. Let me say this, but technically, y'all, the studies are not really supportive of a menopause because you have men in their 70s, 80s still enjoying sex. And so,
Wow.
yes, there are men that go through, low, but a lot of men in their 50s, 60s are, they're still doing good in the bedroom. If you have something like erectile dysfunction or you have where your blood flow is low, now with Viagra and Cialis, I have patients that tell me, please don't give my husband any more Cialis so he can leave me alone.
Wow.
Don't give him another prescription. And I'm like, ma'am, that's not my problem. I have to give it to him because he's asking. It's now going to be your problem. So a lot of times men are doing well nowadays until they're literally, I'm telling you, 80s and sometimes even 90-year-olds are still having a good sex life.
Wow. So I want to know more about these like Cialis and no, I mean for real because I want to know.
If you're gonna be able to take that later on and still be, that's what you really want.
That's not what I want to know. What I want to ask is whether or not there are serious side effects with those things.
Yeah, because I heard like blindness. Remember back in the day?
But,
when they were saying
but I don't know if any of that stuff is still a concern.
No,
Are they pretty safe?
It is a small portion. But the main side effect of Cialis and Viagra, they're what we call vasodilators. So they're going to dilate your vessels, especially in the genital area, allow a lot of blood flow so that you can get that erection. And so if you have heart disease and you're dilating vessels, then you could kind of disrupt plaque flow. You can have a heart attack. Sometimes dilated vessels can lead to other things, strokes. And if you have issues with your eyes, certain retinopathies, it can cause a blindness. Now, let me just say, it is a small portion to this blindness. It's not a high percentage, which is why so many men take it and they do well. So, there are side effects, but I want to say that most of the men who take it are loving it. They are.
but the wives are like, make it stop.
Okay. Yeah,
So, since we're on this, there is no. I just want to know: is there a what is it called?
Cialis.
Cialis.
Yeah.
Okay. For women, not necessarily that particular brand, but I'm saying something that will keep women moist.
Yeah, listen, there is. They kind of came up with a Viagra for women. Cialis, women cannot take.
Okay.
They kind of came up with a Viagra for women that kind of helps with the blood flow as well. And as we age, we get vaginal dryness. And so that's where our estrogen creams come in, or you have estrogen rings that you can put in. And then you kind of have the Viagra for women that you can try. So we actually have a lot in our bag for women that we can kind of pull out, besides just the plain lubricants also. So you have those. So, we have things that can help stimulate us as well.
Can we ask about lubricants?
Yeah.
Well, since we're on it, but you jumping my.
Okay.
She just mentioned lubricants.
Okay, let's talk about it. Let's talk about it because we talked about people have suggested different lubricants. So people have suggested Vaseline, which that's.
We're asking you, is that okay?
Anyway, Vaseline.
No, it's not.
Yeah, I didn't think so.
So don't use Vaseline. Okay.
Coconut oil. Okay.
That's okay.
Certain oils, avocado.
Give us some. Give us some.
Yeah.
Ones that you.
So let me say this. You can use the extras, but I'll name those as well. First, I just want to start with there are vaginal lubricants that are water-based or silicone-based that are in the stores that they are made for sex. those are going to be your best bet when you go into a store and and there are some prescriptions, but most of them you can buy over the counter. So when you see these water-based, silicone-based, those are the best ones, especially if you ever have diaphragms or if you're using rings or if you're using condoms. These are the ones that will not interfere. The other ones we mentioned, like petroleum jelly, mineral oil, people use baby oil. Yeah, I mean, listen, to use those, I think they may cause yeast infections. That's why I tell people not to use them.
Oh.
But however, if they don't bother you, they can't interfere with your diaphragms. They can't interfere with condoms. They can't interfere with, if you have intrauterine devices. So they don't really recommend those. But there are people who love avocado oil. They tell me that works for them and it doesn't bother them, and that's okay. So even peanut oil, there are people who use peanut oil and say, I really like it. So those are actually, yeah, you can use them. But let me say this. It's
Kim just came on and said, what did I miss?
Right. Kim, where have you been? You missed a lot. I miss you, Kim. Let me get you. But no, honestly, I think that our vaginal pH is, a lot of us women are sensitive, to what we're putting in our vaginas. And so it is a silicone water base usually is okay. But once you start getting outside of that into different oils, you could get some irritation. I don't think it's wrong to try. If you really want to try avocado oil, I'm not sure why you would, but if you want to, yeah, sure, try it. If you want to try peanut oil, you can, but I'm just telling you, there are better things out there that are already, pre-made for your pH. So I would stick with the...
Anna said, my OBGYN told me coconut oil instead of KY jelly when we were trying to conceive, and it worked like a charm.
Oh, that's good. Yeah, like I said, if you can take it, I think it's okay. But I think the issue is that most people are not used to using those type of oils in their vaginal area, and so it could disturb the pH. But girl, if you got pregnant,
and she got three girls.
Exactly.
So
now
maybe
maybe she could try the peanut oil and the avocado and tell us how well that works. I mean,
she don't want to have no more kids though.
Right.
I was gonna say, let me know. I have not put peanut or avocado oil, but I know people who do use it. So you can use peanut oil.
I overheard you and April talking.
Yeah.
And I heard you say it again just now. You said something about pH. What is that? What are we talking about? You said you don't want to put anything that's going to disrupt your pH.
Yeah. So, the lining of your vagina, we have certain cells that are there. We have different, like our body makes mucus. It creates lubrication. It creates all of that. And we have bacteria. The bacteria that's actually good for our vagina is there. And so sometimes, unfortunately, even having sex with your partner can throw off your pH. Sometimes condoms, like I said, using different types of lubricants can throw off. Douching, things like that. Your vagina is like self-cleansing, so it's automatically like recreating this lubricant. So when anything gets in there and it kind of bothers it, it can mess up your pH, and then you're like, why does it smell like this? Why do I have this yeast infection? What's going on? And so, it does depend. We tell people don't douche. Do not clean out your vagina. It cleans itself, okay? Which is going to lead us into vaginal smells and things that can be going on when you have it. So I don't know if you guys want me to go into that.
Well, I just want to say that we had a guy who said to us he tries to enjoy or please his wife down there.
Orally.
Orally go down.
Yes, and every time he does that, there's a very pungent, isn't that the word?
Yes.
Smell that he can't take. And so he can't, he feels like he is not giving her what she wants, but he just can't take it. And so the question is that just her smell? Or is that a sign that something's wrong?
Yeah.
Something is going on. Ladies, I just want to say this. Your vagina, let me be clear, should have no smell, okay? So, and you may have, natural sense for your body, but your vagina should be a very mild, almost non-odor smell. If you smell anything, you're going to have to get that checked out. And so let me say this.
Wow.
I feel like people need to be open with their spouses. Like your spouse should be able to say your breath stinks. Okay. You
Right,
need
right.
to take a shower. Okay. Your behind is a little bit strong today when you went outside. Okay. Your vag is smelly. I just feel like everybody should be okay. Like who better to tell you than your spouse before you? So I think first I hope that he would tell his wife, hey, this smell is strong. And then you have to go to the doctor. And let me say this. I just want women to know there are many bacteria that could be in your vaginal area. And it doesn't mean you have an STD. It doesn't mean things like that. But I do want to say STDs do have smells. So certain ones, especially if you have BV is no longer considered an STI. It used to be, but nowadays it's the actual bacteria that could be in your vagina, and it just overproduces. And so we do it with the whiff test. So as soon as I put the speculum in your vagina and open it up, if I whiff and it smells strong and it's
I should not be laughing
smells
about
like
this.
fish. No, I'm serious. It smells like a strong fish, and you're like, you have BV, and that takes a flagell, or what we call metronidazole vaginal insert. You need to use that for a couple of days. Honestly, and if you're on your menstrual cycle, even though that is not the best smelling time, but if your menstrual cycle is even super strong, you may have BV there. And so, I always tell women that it should not smell. I don't care if you wash it should not smell. After you are getting an odor, you need to go and get a vaginal swab.
And so what would you? Oh, really? E.
Yeah.
coli? Okay.
People can have E. coli in there. And you know how E. coli is the main bacteria that causes urinary tract infections.
Oh.
So that same bacteria can get into your vaginal area and cause. So that has a bad odor besides BB. So there honestly, I mean, we could go through, there are many bacteria that could be in the vagina where it should not be, and it could become.
And so what would you say, what would you recommend that they take in order to get rid of it? Is it an easy fix?
Or you got to get some kind of prescription.
No, you do have to get a prescription, but it's an easy fix. So honestly, it literally is just your OB-GYN or your family doctor going in, swabbing it, sending it to the lab, and seeing. Generally speaking, like, when I'm doing an exam, I can smell what I think it may be. Like I can open it up and see yeast. Okay, you have a lot of yeast here. Okay. Or I can smell the BV. And I'll swab anyway, just to make sure we're not missing anything else. But, we can treat sometimes that day, start the treatment that day. But yes, if you are having a smell, it really does mean that you should get a swab.
Got some people that are, feeling you. Doc Swan says, great topic, good info. Dr. Brandy's expressions are cracking me up.
Okay, I know. I know it's my face. I'm going to try to stop. My husband
Primo said, the doctor face on pungent smell.
I love it. It's like, ooh. Yes, so I want to say to the chimes, guys, if you have any questions, just put them in the chat. And
Crystal says, smell the BV, and then she started crying.
And we'll try to get your questions in.
Yeah, if you have any questions, feel free. And Dr. Brandi says she's very comfortable answering them. And
listen, she's open to answering any questions.
That's right. So whatever you have for us, and we will not assume that you have the problem that you're asking about. Don't worry.
Ask for a friend. You can ask for a friend.
Asking for a friend. Just put that in your. And feel free to share this as well, because there are others that are probably going to need to have this same conversation about sexual health and the way in which it might be impacting their bedroom experience. So
and I really don't think we talk about this enough. We don't talk about the things that affect sex, that deals with health, because really, even with the men with low T, like nobody wants to go to the doctor.
Right.
Right.
I mean, they don't want to go to the doctor. And it's like, if somebody has, I've been in a dorm and you go into the bathroom after somebody and you're like, yo, well, what the, you know what I'm saying? You don't think you would have to say, you need to go to the doctor. Like, I wouldn't think that.
You wouldn't think that.
You just think that person smells. We always grew up saying that they eat certain foods that cause that. You know what I'm saying? But now we're learning that it's more, it could be more than that. It could be more than that.
You have to take it seriously.
Yeah. So let's talk about the difference in sexual peak when it comes to men and women. Okay, because that's really a big deal. especially when we're talking to couples, we always hear, well, her libido's low,
Yeah.
or
Actually, it's funny. Lately, we've been hearing a lot more his libido's low.
we have. We actually have been hearing more his libido's low.
My sex drive is way more than
Yes.
his, and so we've been hearing a lot more than that. And
Lot more.
I wonder if it's the age of the people that we're talking to. I don't know. I have no idea.
I don't know, babe.
But that's why I want to ask
because,
Dr. Brandi, see if she knows. You know
Yeah.
what I'm saying?
Yeah, I agree. I think a lot of women, especially, when you get to 40s, 50s, 60s, start to complain their husband's libido is low. And that goes back to our first, guys, when we said the low testosterone. So by the time he's getting 40s, 50s, and 60s, his testosterone is potentially a lot lower than when he was, of course, 18.
True.
20, 27. And the study of this peaking, let me talk about the study, because when this initial study came out, the man who did the study about men peak in their 20s and their later teens and early 20s, and then women peak in this 40 decade. He basically asked people, like, how many orgasms, when you were having orgasms, how many were you having, and what was your strongest orgasms, and what time of your life was that? And so the men were saying, hey, when I was like 18, when I was 20, when I was 25, I was having a lot of orgasms and they were strong. And as I got older, it got a little weaker. And women were saying, actually, my best orgasms were after I was 35, when I was 40. So that's where he came up with the men peak early and women peak a little later.
Okay.
However, now let me say this: they are coming out with new studies saying that women are really having the problem with sexual desire when they get in close to menopause, which starts kind of midway through your 40s on into your 50s. So then we start having a little low desire or vaginal dryness, so things change. Men, on the other hand, it's a slow, steady kind of decline, I just want to say. So yes, when your testosterone is high, of course the man is going to have strong orgasms. He's going to have a lot more sex, a lot more energy. And that is, when he's, or late teens and 20s.
Yeah.
But as he gets to be 40s and 50s, as that 1.6%, that slow decrease over time, he may start noticing a difference when he gets closer to 50 and even 60. But like I said, man, that's where sometimes a little testosterone, a little Cialis, a little Viagra has helped you all. And therefore, now they are more enjoying the benefits of continuing to have. So I'm with April when she says you must go to the doctor at least once a year, if you're a man or if you're a female. And, most of the time females do, we have to get pap smears, we have to get breast exams, but men can literally skip 20 years and not go to the doctor.
Wow,
So
that's true.
yeah, there's something that's going on. And so I've had many patients come in and, they're like, I don't like coming in here. Every time I come in, now you telling me I have this, and that. I'm like, well, sir, 25 years ago was the last time I was So I am diagnosing you with a few things, but if you would have came in every year, we could have kind of this early.
Right.
So that's,
Oh my
that's the
goodness.
issue.
is very true.
So this is not just people saying that. You really do experience that the male patients that you have very often haven't come in for long periods of time.
Long periods. They tell me I've never been sick. And when they say that, that just means that I've never had a reason to come to the doctor or go to the hospital.
Right.
But it does not mean you don't need your labs checked. You don't need, to make sure your organs are functioning okay. You need to check your blood pressure. And I know this is side of the topic of the sexual health, but blood pressure, diabetes, sugar levels, things like that, you must get checked year by year. And so including your male hormones, especially when you're getting close to 40, you should get them checked.
But you know what? You said that's off topic, but really it's not, because those things affect. They do have some effect on your sexual health.
April, 1,000%. A lot of men don't know they've had high blood pressure for 20 years or 5 years or 10 years. They walk in and they're at 190 over 100 and they're like, I feel fine. And then, we're starting dialysis that day because the blood pressures tilt their kidneys. Or,
Mercy.
they come in with a stroke and didn't know they were 200 over 150. Or, they can't get it up anymore. And I mean, they can't get aroused anymore because the diabetes has eaten through the nerves.
Oh
and
my
now
goodness.
you cannot get an erection. And no Cialis will help that.
That won't even
Once your
help.
nerves are
Right.
damaged, no.
That's it.
Lord
And
have mercy.
so it's not a testosterone problem. It's another medical issue.
So seriously,
Wow,
if
wow.
we could convince more men that
Yes.
their sexual health and their performance in the bedroom would be
Yes.
impacted by regular checkups, maybe
Yeah.
we
They'd
get
be
them
more
all the time.
inclined to
You know what I'm saying? Yeah, you know what I'm saying? I got to get my checkup so I can
Right.
make sure that
And
my
that is the
performance
most
is
important
taken.
thing to men. Let me tell you,
Exactly.
when they come
Yeah.
to the hospital, they're like, "Can I have sex when I leave? And can I eat
Exactly.
what I want when I leave?" They want to
There you
eat
go.
and they want to still have sex. So
Right.
I just want
Exactly.
you to know that those are the main things. Yeah.
Those are the things.
So we got a question that just came in from Primo. What does the doctor have to say about prostate exams, age, frequency, etc.? What age do you think men should start getting prostate exams, and how often?
Yeah, so I think the standard initially was like 40. But let me say this, Black men are more prone to having prostate cancer, especially if it runs in your family. So if it does, I would start around 35.
I've never had a
But you can
prostate
get
exam. 43.
I know.
you can get your prostate levels checked, and that's another way to monitor it. And that doesn't mean you need to necessarily skip the exam, but you can also see if your prostate is off by getting an actual blood work. So you can pull that blood work at 35. So you can see that first, and then generally they'll do a prostate exam after that. So
Oh, we got another comment from some weird person saying, "Dr. Cotton Candy, I love you."
that is what Wu calls me. Oh,
Yeah, that's our boy Wu, and he's a yutz.
I love you.
Okay, so I'm about to pivot a little bit. We're about to get a little dirty right
No,
now.
for real, seriously though, like seriously, share this, but also put your headphones on because they was about to ask about something that your kids should not hear. Okay, go ahead.
Right. So, let's talk about the subject of anal sex.
So we're going to the subject of frequently asked questions to John and April.
Frequently asked questions, okay?
Do we get this question all the
We
time?
get this question all the time, and it comes up a lot during our premarital counselings. And, the question is it okay? And we come from the medical side when we say whatever we say. Now, we have not checked with you.
Right. We start from the biblical side, and we say we give our reasons why we do not think Christians should engage in anal sex, but our medical evidence is not backed by any scientific studies. It's actually anecdotal evidence that we heard from you.
Okay.
From actually a nurse.
Well, we heard it from a nurse.
But you did
confirmed
solidify.
it.
You confirmed.
And
what
another
we said.
ER
Yes.
doctor that we know told us this one thing.
But we won't say
anyway,
anything.
right.
Let
Go
her
ahead.
tell it.
So tell us.
Yes. And somebody told my nod.
Okay.
Richard said nod.
I'm going to start out by saying that this is no judgment zone. What people do in their marital bedroom, I do not
Listen.
judge. That is your business,
No.
okay? And I
Exactly.
told
Do your thing.
Pastor John will come from the biblical aspect, but I am going to come straight medical. And let me say this. I know people are not going to want to hear this, but the anus medically was not made for sex. I'm just going to put it out there, okay? If you can do it, you can have anal sex, but it is not made for that. And let me say this, comparing the anus to the vagina, we have to compare. The vagina is made of thick, elastic tissue that's able to stretch to a penis. It's able to stretch for a baby. It's heavily lined, it's heavily lubricated. That is the very opposite of the rectum and the anal. You have a sphincter there that's supposed to stay tight and squeezed until there's soft stool that should be coming out. It is not lubricated. It's not lined except by squamous cell, and it's easily damaged during anal sex. So we don't love to recommend that. However, the world, there are, millions and millions of people who have anal sex. And so, we have to listen to what you're saying and treat you accordingly. But let me just say this. Like I said, E. coli is in the rectal area, okay? It is a bacteria that is supposed to be in the rectum. It's supposed to be in the colon. It helps break down foods. It's in It eliminates out in the toxins. That is the same bacteria that if you don't wipe well can get into your urine, your bladder and cause a UTI. Also, if you're having anal sex and you transfer, and I just want to be real, if the penis is going from the rectum and then you're not cleaning it and then you're going in the vagina, you're kind of going back and forth, you can have E. coli and really horrible smells coming out your vagina. So I'm going to start with that and say the bacterial infections that you can get from that, it's not really what you want. Secondly, it tears easily. So that area is very thin. There's a lot of blood vessels, so you can tear. You can have what we call fissures. You can have abscess, abscesses that form there that you would have to then get an actual colorectal surgeon to go in there, open that abscess up, drain that out. And then we have something called pruritus ani, which just means you can get fungal, itchy infections to where, you're like, why is my anus itching so bad? And it's because you may have a fungal infection. Lastly, let me say this, and this is the worst thing. There are patients who can correlate anal sex with anal cancer, rectal cancer.
Whoa.
Yeah, so HPV, certain STDs are very easily spread during anal sex. And so they can link it to anal cancers. So all in all, I'm going to say no, avoid it. I'm not judging you if you do it, but I think that what people don't understand is that they do it secretly. They don't want to tell anybody, and they don't want to tell their doctor. And so if you're having anal sex, you would need to let me know, because I would need to look back there. I would need to make sure I don't see any lesions. I don't see pus forming. I don't see any tumors or anything, hemorrhoids that are worsening. So you should let your physician know if you are having anal sex. But I do not believe the anus was made for that. I know it wasn't, actually.
It wasn't based on your.
I know.
And I guess that's where we come from. We don't believe that it was made for that. But again, like you said, we're not judging you for what you do in your bedroom, but that's just from our perspective. So I was laughing because Primo said, why did the good doctor go down to a whisper when she said millions of people are having anal sex?
Oh, did I? Because you know what, Primo, millions are. I'll say it louder. Millions of people are having anal sex. You would not believe, okay? It is just not alternative lifestyles. It is.
Right.
And I think
heterosexual
heterosexual
couples are having it.
Yes.
Anna says none of these risks sound sexy. It sounds like a lot of different risks there.
And I think she went to a whisper because she's thinking about all the things that come from it. Because I'm sure you see that in the hospital. Do you not see things? Do you see that in the hospital?
Yeah, and let me tell you, one of the worst smelling things is an abscess in the rectum. That's bleeding and there's pus coming out. And then the next worst thing is rectal cancer, how that smells. And so.
Now, Doc Swan says this is news to me. I've never heard that Christians shouldn't engage in anal sex. You may need a separate show for this topic. Maybe we will. Maybe at some point we will talk about that from the biblical side. I have some theories about it, but anyway, we'll do it on another show.
That is another show.
Yeah,
that is another
so.
show.
My Swan was purely medical. Okay.
Right.
Yes.
Here's Egu again. Is it true that you are supposed to have sex twice a day so you don't get prostate cancer?
Well, technically, he has a point. It does help. Listen, I don't know how many times a day.
Oh, sorry. You're just saying the more you do it.
But if you do have sex, very regularly, and I would say at least once a day, it can decrease cancers. It decreases stress, it decreases anxieties, and it does decrease cancer. So there are studies to show that. Whether it's 2 or 3 times a day, I say if you got time for 2 or 3 times.
Listen, if you got energy, you got energy for that.
That would be amazing. Okay?
It's been a long time since 2 or 3 times a day. It's been years. Wanda says this is good, so this is still connecting with people. Donnell said transparency. I think he's talking about you being transparent with your doctor to make sure that they know everything. I do just want to ask that sort of as a side thing. Talk a little bit more, Brandi, if you would, about the shame of something and how important it is that I need to actually tell my doctor exactly what's going on without lying, so that my doctor can treat me the way that I need to be treated.
And I want to say that I think it is. I mean, it's so funny because I know that when I've gone to the doctor and the doctor will say, are you sexually active? I'm married.
Right.
And I'll be like,
yes. all embarrassed.
And I'm like, why am I like that? But I think a lot of people do not tell the truth because they are embarrassed.
Are you trained to see through the lies and still know what we're saying? You know what I'm saying? Because we know we're going to lie about everything.
You know what? It is. It can be. Certain things are embarrassing. Okay. So, for men, I'm a female. So sometimes it is hard for them to say, hey, I'm having trouble getting it up with my wife, or I'm having issues. And so, yes, I think you should pick a doctor that you're comfortable with. But once you pick that doctor, you have to be honest, because how do I know? I can't see through your body like you want me to. I don't have x-ray or CAT scan vision. And so whatever's going on, I need you to tell me, because it changes my whole entire treatment plan. If you are only having, and I'm just picking this because we just talked about it, but if you're only having anal sex and you're not telling me what's going on, I may never look at your rectum. I may never look to see if you have hemorrhoids or infection, or I should swab that area, to be honest, to just make sure. But if you don't tell me, it's something that a doctor could potentially skip. And so I just want to say my own personal OB, which I love her, because she don't care who you are, how long you've been married, what you're doing, how faithful you think your husband is. She was like, first of all, I don't care, and I'm swabbing you for everything. I'm going to check you for HIV, I'm going to check you for gonorrhea, I'm going to check you for chlamydia. Because she's like, some people don't come in and they're not truthful, and I don't want to miss something. And so she's the type, she practiced that defensive medicine where she's like, we checking for everything, I don't care how you feel about it. And so I'll be like, well, I've been married for 15. She's like, I don't care about that. What if something happens? What if your husband, or what if this is going on and you don't know? And so I think that, all your symptoms, yes, you need to tell. You need to say, especially sexual wise, what's going on in your family history. We can miss something just based on, if you tell me, like my uncles, like at least 5 of them had colon cancer. That's going to change when I do your screening. That's going to change. So it changes things. So you have to be transparent, because let me say this, when you walk out the door, I don't know you, unless you're my friend, yes. But I am not calling your mama up. I'm not going to call your husband, your spouse, your friend.
Right.
Nothing is leaving my room. And every doctor is the exact same way. We see thousands of patients. And unfortunately, patients think, like, if you see me on the street, you're going to remember everything about my medical history. I won't, literally. Because I have 35 people after you I will not remember. But when you are with me, I need the information. I'm not going to see you on the street and be like, oh, hey, April. Yeah, she's the one here.
Right.
And it doesn't work like that. We're not concerned, and we just want you to be honest so we can get the right treatment to you.
So we got a few more comments on here. Apparently some people are happy that your new anti-cancer campaign. So 3 times a day. Thanks so much for that. Brian Goodall says, for me to get to 3 times a day, I need a doctor to provide child tranquilizer darts. This kid doesn't go to bed early enough, so there's no way that could happen. But we did have
we'll take once a day.
Right.
We do have a question from Camille Beckford Johnson, who says, what do you think about steaming? The V-steam is popular here. I've never heard of that. I'm assuming she's talking about steaming
because
her vagina.
I think Jada Pinkett and her mama and all them did
talking
that
about
together.
I don't know anything about it.
Yeah.
I think, they have in Atlanta, I want to say they have a spa that does that vaginal steam. And let me just say this, you don't need it. Remember I said that the vagina is self-cleansing. You don't need anything extra in there. You don't need the steam. It may not hurt you. It may not change your pH. You can try it if you like. But let me say this. I would not go to a place and I don't sit on something that other people have sat on in the steam. I don't know what's in that. How clean is that canister? Like, is it just the herb? Like, did they clean that? I am a germaphobe, so I'm always concerned about that. So, no, honestly, is the actual steam and the herb and whatnot hurting you? Probably not. But do you need it? Is it going to really do something amazing for your vagina? No, it's not. Wow. It's just a fad. Unfortunately, it's like, I would say something else, but I don't want to offend people. But, when you drink all this, alkaline water. It's the same thing. Your body is a pH of 7.4. I don't care what you drink or eat, it's going to bring it back to 7.4. So is it
Oh.
really
Wow.
chemical? Water is naturally alkaline. So you could drink it out, the spring, and you'll still get the same effect. So a lot of things are gimmicky, and people swear by these gimmicks, but no, in general, it's not
Wow.
healthy.
Tell the truth.
Okay.
Yeah.
Okay, so
We're wrapping up, by the
wrapping it
way.
up, but we got a couple more questions. What are the drawbacks, or are there any drawbacks to having sex on your period? I know a lot of people, they don't have no problem with it, and so, and I, whatever you do, whatever. I just, I think you need a break. I need a break
Yeah.
from this one right here.
I
I
actually
think it's a nice break.
I actually like the break that gives to
It
us.
does. It gives us a nice break.
Every month. It's nice. But anyway, what do you medically?
Yeah.
Okay,
medically.
so
Yeah.
medically, not biblically. So I think
No.
there is something biblically on this. However, the main thing is that it's a mess, y'all. And do you want to do that on your period? Like, let's just be honest. Do you want to lay towels down and have blood everywhere? I tell people, take the break, But I think the reason why people want to is because women's hormones are changing, on your menstrual cycle, and they do feel sometimes more aroused. So
Right.
they will get strongly aroused on their menstrual cycle, and they just feel the urge to have sex. And I get it, because the hormones are, one is going up, progesterone, estrogen, one's going down. And so they do feel that what people call horny feeling, that they want to have sex. And so they do sometimes. So there's nothing that's horribly wrong or that's going to happen to you if you're having sex on your period. But like we said, it can create a messy environment and situation. So I just recommend kind of, wait till the end,
Yeah. Okay, somebody just asked Doc Swan again, what about sex toys? Are there any risks to using sex toys?
No, only if you are not cleansing them well. So I would make sure that they're clean, they're sterile before you're using them. Now, like I said, if you're using them in the anal area, it's just like having anal sex. You could what we call perforate, which is poke a hole in your colon. So your colon is nicely lined and everything's coming out smooth. And so when you stick objects or, even the penis in the rectum, it can easily puncture through and now create air and stool and, things like that. That's a surgical emergency if you have that. You'll have severe pain. So for that reason, I don't recommend putting anything in the rectum. But other than that, if you want to use toys, I think that's okay. Just make sure they're clean and they're very sterile. And you lubricate.
Ebony says, if you really want to do it, buy a humidifier, throw some chamomile sleepy time.
Right.
That's basically the same thing as the steamer. You know what I'm saying? At least you won't be sitting on somebody
funny.
else's joint. You know what I'm saying?
That was Ebony.
Oh yeah, Ebony said that was a good one.
That. That's hilarious.
I love it.
Okay, so last question, and this is
First of all, Brandi, this has been great.
no, this has been great.
You're
You
amazing.
are amazing.
I'm riveted to every answer.
I mean, I'm like, I need to just call you.
We need to literally have like another just ask Dr. Brandi.
Exactly.
You know what I'm saying? Like a segment. You know what I'm saying?
We do. We should start
Send in
that.
those questions. They can just send in their questions.
Exactly. That's what we'll do.
Yes,
Anyway,
I love that.
give one more.
So, what medical suggestions would you give to a woman who's having pain during sex? A lot of women have pain during sex, and they don't know what to do.
And we've heard about this new thing. Well, it's new to us called vaginismus.
New to us. Like, never heard of
We
it.
had never heard of it before until recently.
Yeah. And it's like we know about men having trouble. We don't know about the things women are going through.
So it's two terms that they use. It's either vaginismus or dyspareunia, which is the same thing. It just means pain when you have sex. And honestly speaking, you guys, it depends. So is it pain when he is inserting, or is it pain in the midst of sex, like when the man is deeper, or is it tender all the time, even if you wash it, or if you, so it breaks down into where the pain is. And so, for most women are feeling pain in that menopausal time, like where the vaginal area is dry. And so if that's the case, then of course there are estrogen creams, there are estrogen rings you can use. Sometimes women can feel it after childbirth, and they kind of get the same thing where they have low estrogen at that time, they can have pain. So that's different. You can also use creams. Now, the problem is it can also indicate that there could be some kind of vaginal cancer, cervical issues, uterine issues that you want to get checked out. So why are you having that pain? Is there a tumor there? Is there a growth? And also certain STDs are painful, especially chlamydia. It causes cervical tenderness. So very tender when you're having sex. And so when the man his penis is hitting that cervix, you're going to feel an extreme amount of pain. And that's called cervical motion tenderness. And so it's not just a one size fits all. Like, I would have to really get in your business, which I like to do, and ask you exactly, where is this pain? Like, what is happening? What is he doing when you're feeling the pain? What is going on? Is it at the insertion? Is it just dry around the area? Could you have, some kind of yeast infection, or could it be an STD? So, there's just not one answer, but you definitely need to get that checked out.
But if you are, you need to let your doctor know, I'm having pain during sex.
April, that is the main. Go to the doctor.
Yes.
Ladies, even just go every 6 months and get a vaginal swab, just because. Make sure you're okay. Get your pap smears. Let someone look in there. That is a medical expert and tell you everything's okay. Because there's nothing better for me than my doctor being like, everything is clean. Your labs look good. You're okay. Nothing's wrong. Nothing is, your death is not imminent. You don't have a big tumor here. You don't want to miss that, Because I'm a physician, but, I'm a little bit of a hypochondriac. Let me just say that to you. So, and because I know too much, I check too much. So I'm like, well, give me an ultrasound. Ultrasound my ovaries. Just give me a CAT scan of everything. That's what I do. So it's true. You can do too much. But I'd rather a too much patient to tell me too much, and I can kind of tease out what I need to know, than for you to tell me nothing, or you never come. And then you come in and we have a huge problem.
So there it is, guys. So if you are a guy or a gal, make sure you go to your doctor. If you're living in the Atlanta area, just go to Brandi's hospital. Maybe you'll get her.
Well, she's saying you don't want to be admitted.
Yeah, you definitely don't want to be admitted, though. That's the problem.
But you know where to go if you need to go. You know where to go.
Wu says she is photogenic. She needs a show. You need to have your own show.
I love him. Thank you, Wu.
He's in a good mood because his daughter turned 10 yesterday.
Right.
I'll take it.
Exactly.
But we agree with Wu. He's right. You are very
definitely.
photogenic, and you're also
beautiful.
You're equally as intelligent. So thank you very much for
out.
that. You have helped our show dramatically today.
Yes.
Keep going.
But I mean,
we're gonna have you on again, Brandi.
We're definitely having Dr. Brandi back. So glad.
People say no, thank you. You know what I'm saying?
Thank you, Wanda.
Exactly. We're definitely going to have you back because it's just important.
Yeah.
Sometimes we just need these questions answered, and some people aren't going to their doctor to ask these questions. And so hopefully this will get people to go to their doctor so that their sexual health can be better.
Yes.
You don't want something that can be simply fixed, a simple fix.
Very informative, Brandon.
Oh, thank you.
It's accidental, I think.
Yeah.
She meant Brandon.
Brandon.
Yeah, I appreciate it.
She does have a son named Brandon, but it's not spelled that way. Very good presentation, June says. So people are definitely loving it. Thank you, Brandi.
Yes, thank you so much.
I know you normally go to sleep way earlier than this. There's a guy named Jason on here saying you're gorgeous, by the way.
When I'm on call.
I wonder who.
I'm not on call.
Oh, okay.
Okay.
There you go.
Who's this guy? Who is this guy on here saying you're gorgeous? She's married, dude.
Yeah,
She's married.
Thank you, husband. He's got to say that. I just want you to know he has.
Well, he has eyes, so
Exactly.
Thanks for the educational information. Yes, so tonight was good. Thank you very much.
Yeah, I just want to say I know that there is it's so much. We can't cover everything. I mean, we could literally go and go and go. But I love answering questions, and I can't wait to come back.
Yay.
Good. Thank you, Brandi.
So glad to hear that.
Thank you very much.
Yes.
See you next time, whenever that is. All right.
Thank you.
Bye.
Bye.
Man.
Love you too, Brandi.
That was really good. Brandi's amazing.
She is. And y'all, when I have medical issues, I call Brandi.
Right, and that's why. because she knows the
I'd be
answer
like,
to pretty
what
much
should
everything.
I do,
You know
Brandi?
what I'm saying? Right. So Primo says what he learned tonight is that Shalita must have sex with him multiple times a day to keep his cancer free. Let the helpful living continue.
That's all you got, Primo.
We need a show for people over 50 health. Yeah, that's true.
Okay.
Anna says that was great. Yeah.
Yeah,
Thank
because
you,
John
Anna.
has
Glad
already
you're-
made himself 50, so we might as well just go ahead and.
Oh, man.
That was really good. I think we should be Team Brandi tonight.
Oh, there's no question.
Team Dr. Brandi,
Yes.
and go ahead and put in hearts. Go ahead and click the heart for Dr. Brandi.
Yes.
And we're gonna be Team Brandi tonight.
We
So
still have.
don't say anything to try to make people be Team John.
I won't.
It's Team Brandi
I won't say
tonight,
anything.
babe.
Oh,
Okay.
I'm not saying nothing. You know what I'm saying? So we do have to give the coupon code tonight. We have
Yes.
we have a 50% off coupon code just for our viewers today that will last until Sunday. It is for our 30-day intimacy challenge. And so we need to give that away tonight. I want to do that right now. Actually, can I do that?
Yeah, go
that
ahead.
That means I need to change music here. You know what I'm
Okay.
saying? So let's go. I don't know if this is the kind of music that you want. Do you want this?
It's fine, babe.
You want
What
something
about
else?
show end?
Let's see.
It's supposed to be the show end.
Yeah, let's do that one.
There you go.
That works for me. I have no problem with that.
You got the code, babe?
I do have the coupon code. It's about to be on the screen right now, and bam. Your coupon code is CHIMES50.
Times 50.
CHIMES50 at checkout. You get 50% off your 30-day intimacy challenge. It's good until Sunday, May the 1st at 11:59. And this is actually a program that we believe will help your intimacy go to the next level, no matter what level you're at.
Okay.
And there are several people that have taken it and have thought it is something that has
Very
helped them
beneficial.
dramatically. And so, you know,
So I just put in the chat, guys. Go to www.justjohnapril.com. Use promo code CHIMES50 to get 50% off.
yep,
And that lasts till Sunday.
it does. And we might have a special surprise for you this time around. We'll probably announce that a little bit later on. But for those of you that use this code, you'll get 50% off at checkout. And you'll be able to join us in the challenge. We'll be excited for that. So, what did you think about, what was your takeaway from tonight's show? Because I have a takeaway.
Okay, my takeaway is I'm glad my hoo-hoo don't smell like that.
I am too. That's a good takeaway.
That was scary. Those smells, I was smelling the smells just by the way she described it. That was a little scary.
My takeaway is that I need to be more open with my doctor, and I need to actually go to the doctor more often. I still have
You
not
do,
had.
babe.
I still not have had a prostate exam. And I'm 43, so I need to do that.
And you've had cancer.
I have had cancer.
Why
So-
are you not going to the doctor? It's like,
Well, I go to the doctor when you make me an appointment. But, you know
but
what
I'm saying, okay, look at Primo talking about Team
Team Brandi and April.
talking about subliminal
What I
Team
did
John.
there. April next to subliminal Team John.
See, Wanda agrees. She said, "Me too." Exactly, Wanda. You like, thank you, Jesus.
Oh, that her stuff don't not like
Ooh,
that.
honey, I can't. I cannot.
Camille says the challenge is really good, guys. I need to redo it. You may have a chance to redo it, Camille. Actually, that's
Come
one
on,
of the.
Camille.
yeah, we'll
That's
see.
a little
You know what I'm saying?
surprise that's gonna
Yeah,
come
yeah.
later.
But anyway, we're excited.
Yes.
We're excited. Thank you, Dr. Brandi, once again. This is we're gonna have her back, guys. Listen, it's gonna be a segment. We're gonna have a segment in our show that we're gonna actually say, ask Dr. Brandi, and we'll tell you beforehand. You'll be able to send us whatever questions you want,
Yes.
and we'll have a few of our own. But we'll make it so that you can ask her whatever, and we won't make it only sex. You know, she can talk about anything.
Exactly.
We want our people to be healthy. We want healthy chimes.
That's
you know
right.
What I'm
We
saying?
want healthy chimes.
Yeah.
That's right.
Anyway, before we go, you can share it. If you haven't shared it, you can do it now, and people can still watch it later. This is something that they need to see.
Yes.
And,
this was some good information.
It really was.
Really, really was.
So thanks for rocking with us again tonight, guys. We will see you next week.
Yeah.
I think we'll be here, right?
Okay, we gotta be consistent again.
We do.
Yeah,
Well,
we gotta be consistent again.
Love
Y'all
y'all.
understand though.
See
Love y'all.
See y'all next time.
Bye guys.